Welcome. I'm glad you're here. This class teaches the first step in the TAOFit method, how to perform a full body self-assessment. By practicing the same movement assessment each day, you will be able to perform all of the movements without following the video. You will be collecting data, noticing specific areas where tension shows up, how it shifts, and what's becoming a pattern. This kind of awareness gives you options. You can address tension early before it compounds into larger issues that eventually lead to pain in other parts of the body, often far removed from the original problem source, at which point the problem can become harder to identify, more expensive to treat, and more disruptive to your daily life. We will move through the body joint by joint, from toe tips to fingertips. Your focus is to slow down, breathe, pay attention to what you're feeling within your body. Pay attention to imbalances. Can you move as far? Is one side stiffer, tighter, more restricted, less stable, pinchy, or just a little off compared to the other side? Notice, does tension or discomfort in one area, big toe, wrist, knee, feel connected to tension in other places? Hip, low back, shoulders, or neck? Is all the tension on one side of the body, or does it cross midline and affect the other side? Take notes, especially for the movements that feel sticky. You can spend a little extra time and reps with these movements throughout the day. By the end of each day, reassess to see if the movements feel more balanced between the sides. Throughout the class, follow the rules of pain. The link will be down in the description below. Pain is a binary. It's either yes or no. If yes, rate it from 0 to 10. Stay below a 3 out of 10. If pain shows up on your face, a squint, a grimace, making that pirate look, that's your signal to back off. The rules of pain are the most important guideline in the TAOFit method. If you want to move with less pain, your body needs consistent experiences of pain-free movement. Otherwise, you're reinforcing pain at the neurological level. Again, rules of pain, link to a video will be down below. 1-minute video, please watch it. Let's get started. We're gonna start on the floor with what we call crocodile breath. The idea is that we're breathing, working on getting our breath to breathe like a balloon or a crocodile, getting that nice expansion through the abdominal wall. We're gonna make 2 big C shapes with our hands. Hands are gonna go below the rib cage and above the hip bone in that nice meaty section of the abdominal wall. And we're gonna cinch those hands down. Our hands are going to be an assessment point so that we can feel symmetry through our breath. I wanna notice, how does our breath move right side of the body, left side of the body? I wanna notice, how does it move into the front belly, into our low back space, and out through the sides. So we're gonna use our thumbs, pressing into the low back musculature. Index fingers are wrapping around so that we can feel a little bit of the abdominal musculature on the front, and our palms are pressing into the side so that we can feel the side body space. And we're gonna take nice inhales in through our nose, exhales out through our mouth. As we inhale, I want to feel that balloon expand out, that abdominal wall expanding out like a balloon, pushing into the thumbs, palms, and index fingers. As we exhale, we're gonna draw our navel up and into our spine. And one quick thing, if shoulders and neck are lifted off the floor, if it's hard to get them to soften and relax, especially with our hands in this position, it is okay to have a pillow or a bolster underneath our shoulders and head in order to allow us to be a little softer and more relaxed. So we're gonna take about 5, 6 nice, deep, slow breaths. I want the inhale phase to be about 5 to 8 seconds, as well as 5 to 8 seconds for the exhale phase. And with each inhale, see if you can get that balloon to expand a little wider, a little bigger. And with each exhale, feel those hands cinch in so that you can create a little more resistance to push out on with your inhale. And then as you're getting into this breath, start to notice the difference on the right side and the left side, especially the thumbs and the palms of your hand. Those are the areas where we tend to get a little sticky and we don't get as good of a breath, emotion into our breath. So can you feel that push into the thumbs and into the palms? And is it a little different on the right side compared to the left side? And once we get 5 to 6 breaths, we're going to slowly shift. We're going to come up to our hands and knees, getting into a quadruped position. Now we're going to come back at the end of class and we're going to reassess that breath. Hopefully through doing a good amount of joint mobility, we're going to find that that breath actually improves significantly from the beginning of the class to the end of the class. Coming into quadruped, we're going to spread our fingers nice and wide, ground palms, extend the elbows fully. I want hands directly under the shoulders, knees directly under the hips. We're going to tuck our toes underneath. I want to feel that big toe tucked as much as you can. Feel a little stretch into that big toe space. Get some of those other toes tucked underneath as well if you're able to. We're going to start with some wrist mobility and then we're going to do some foot mobility. Then we're going to get into pelvis and spine. So starting with wrist, we're assessing both wrists, right side, left side. I'm inhaling as I rock back, hips into my heels. I'm exhaling as I slowly rock forward, loading into the wrist space. Inhale, unloads. Exhale, loads. I want to make sure we're not pushing into pain. I want to notice, how does this feel on the right wrist compared to the left wrist? Is one side stiffer, tighter, more restricted? Is it a little uncomfortable? And we're just going to do about 5 to 10 reps of each movement. Once we're done with our rocking forwards and backwards, we're then going to turn fingers out to the side and we're going to do a little bit of side to side glide. Now with this side to side glide, I like to have a push and pull effect. I'm pushing through away from one palm as I'm pulling in with the other palm. And we're moving side to side. My breath is inhale at the center. I'm exhaling as I move over a wrist. Inhale to center, exhale over the wrist. I'm still maintaining my 5 to 8 second breath count. I want to move slow. And I want to notice, how does this feel, left wrist compared to right wrist? Once we get 5 to 10 reps, now we're going to turn those fingers all the way back towards the knees. The closer the hands are to the knees, the less intense this is. The further out we walk, the more intense. I don't want this to be super intense. So we're going to pull them back towards the knees. I want the palms rounded. I want them touching the floor. We're inhaling as we rock forward on this. Exhale as you let your hips sink towards your heels, loading into that forearm space. I want it to be a light load. I don't want this to be a massive stretch. I want to be moving within what feels comfortable. I like the word juicy. I want it to feel like a good, juicy stretch. I don't want it to feel stressful. And again, notice the difference, right side to left side. On this particular movement, it is not uncommon for your dominant side hand, the forearm, to feel a little bit thicker, tighter than the other side. So that is expected. Once we get our 5 to 10 reps, we're going to flip the palms upside down to the back side, and we're going to let the elbows bend a little bit. Now, this position can be a little uncomfortable if it's your first time doing it. So let that weight be in your legs and less on your hands. From here, I'm really wanting to assess the elbows more than anything. So we're going to lightly press into the floor to extend the elbows. And we're seeing, how much extension can we get? Is there a stretch there? If there's a stretch and you're not able to get those elbows fully straight, then we're going to play in that juicy nature of the stretch. We're going to exhale as we extend into it. Inhale as we let it soften. And with each one, we're seeing if we can get a little bit straighter, without forcing it. Now, if you have good elbow extension, you're able to get those elbows fully extended and there's no stretch. I don't want to lock them out, but I do want to actively straighten them. And from here, we can do a little bit of rocking back hips to heels. Again, this should be not painful. And I want to notice the difference right side to left side. Now, once we're done with that, we can come off the wrists a little bit, roll them out, give them a little bit of love. We're going to come back into the quadruped so that we can now get into our pelvis, or actually we've got to get into our feet first. So coming back to our quadruped, nice spread hands, grounded palms. We're now tucking our toes, keeping those toes tucked. So that we're now going to assess the big toe as well as the rest of the toes. So I want that big toe nice and tucked. We're inhaling as we rock forward now, and exhaling as we feel the weight of our hips sink between our heels. And I want to specifically feel that load into the big toe joint. Inhale, we're rocking forward. Exhale, we're rocking back. And as you're moving back and forth, start to notice, how does the right big toe feel compared to the left big toe? Is one side stiffer, tighter, more restricted than the other side? The big toe is a major point to assess. There's going to be some difference between the two. So if you're not feeling it yet, it may take a little time for you to kind of develop the sensitivity to notice how one toe feels compared to the other. Once we get 5 to 10 reps, we're now going to let our heels roll out and away, and we're going to see if we can get our toes tucked all the way underneath to that pinky toe. We're going to do the exact same thing. Inhale forward, exhale as we feel the weight sink to our heels. And with those heels rolled out, we should feel that stretch through those lateral toes and a little bit to that lateral side of the arch of the foot. How does it feel different on the left side compared to the right side? Is one side tighter, more restricted? Does it feel more limited in its range of motion? Then, after 5 to 10 reps, we're then going to untuck our toes and we're going to let our ankles go nice and flat to the floor. And now we're looking at the front of the ankle space. We're continuing with our nice exhale, hips to heels. Let those hips sink down. I want to notice knees. I want to see how close we can get our hips to our heels. Inhale, we're rocking right back forward. Now the things to notice: are we able to get both hips close to the heels, or does one hip not want to go as far? That can be an indication of some knee inflammation, so we want to pay attention to that. The other thing is the front of the ankles. Does one ankle sit higher off the floor? Are you able to get them both flat, or does one side feel tight, restricted, and won't sit down flush? That can be an indication of some immobility in the ankle joint, so we want to pay attention to that as well. If you're able to get hips all the way to heels, we can let the hands start to slide back as we come more into this deep kneel position. Again, continuing to rock out of it and to rock back into it. This is an assessment, so I want to feel, how does the position feel? Right side of the body compared to the left side of the body. We'll come back to our starting point in our quadruped, hands spread, toes tucked again. And now we're going to get into some pelvic tilts and movement through the spine. So coming back into that breath focus, that nice inhale into the belly. As we fill in that belly, we're going to let that belly open up to the floor. The pelvis is going to start to tilt to the floor, and we're going to get a big sway in our low back. As we exhale, we're going to draw that navel into the spine, and we're going to start to scoop that tailbone. If you imagine your sacrum is the palm of your hand placed right here in between the hips, Your fingertips are your tailbone. I want to imagine that we're scooping and we're trying to point those fingers towards the floor. But I want this movement to kind of remain in the low back to start with. As you inhale, feel that belly inflate to the floor. I want to avoid any kind of pinch or pain in the low back. Exhale, feel that scoop, but we're only letting that movement go up into that low back area. How does this feel on your inhale phase, moving into lumbar extension? How does it feel on your exhale phase, moving into lumbar flexion? Is it tighter moving forward, or is it tighter on that scoop? And is there pinch? Is there some discomfort? Those are very important assessment points. Now we're going to start to let this movement move up the rest of the spine. As we exhale, scoop, I want to feel that movement continue to move up the spine to the shoulders. Once we reach the shoulders, we're pressing into the floor. Allow those shoulder blades to round over the top. We're going to let it continue to go over the top of the head. And we're going to try to touch our tailbone and our forehead at this imaginary point right in the middle. See if you can feel your core light up on fire. And then on your inhale, it's going to pull the pelvis to the floor. That's going to move each segment one at a time towards the floor. As it gets to the chest, let your sternum drop and your head will come up last. So we're exhale, scoop, feel that nice wave, move up the spine to the head. Inhale. Same thing. Can you start to feel that nice wave? Move up the spine, starting at your tailbone. And moving up to the head, one vertebrae, one segment at a time. And by getting this nice wave-like action, you might notice that there's some segments that feel a little stuck, a little sticky, and they don't move quite as well. So that's what we kind of want to assess. And where do you notice? Is it in the neck, thoracic area around the chest? Is it in the lower ribs, or is it down in the low back area? Those, again, are going to be good things to put into our notes. All right, last thing in our quadruped. We're going to walk our hands forward of the body. I want to try to keep the hips straight over the knees. However, if you are experiencing some shoulder instability or discomfort, this can feel a little vulnerable on that shoulder. So you're allowed to let those hips sit back a little bit in order to take some of the stress off your shoulders. But eventually, ideally, with good shoulder health, we can kind of walk out. This is where we want to get to eventually. Nice spread hands, grounded through the floor. I'm pushing into the floor. My elbows are active and straight. I don't want to let them get soft and passive. From this position, we're going to come back into that breath with the pelvic tilts that we just did in our quadruped. Inhale, feel that belly open up to the floor. Pelvis is tilting down. Exhale, navel to spine as we scoop. And what we're doing here is on that inhale, as the pelvis tilts down, we're noticing that the rib opens up, moves to the floor. We get this big rib flare. As we exhale and scoop, that rib is moving towards the hip. That core should kind of get tight and tense. I want to feel that tension in the core as we get into our child's pose, which we're going to do next. So on your next inhale, feel that belly open up. As you exhale, feel that scoop, that tense core. And at that point, we can start to drop our chest to the floor. Inhale, we're coming up. We're letting that belly open up to the floor. Exhale, scoop. Feel that core lock in as you start to drop and reach the chest to the floor. Now, as I'm moving to the floor, I want to keep this downward pressure in my hands with my elbows straight so that we feel this kind of mobility stretch at the shoulders. specifically feeling into that elbow pit or the armpit area. How does it feel right side compared to the left side? Does one side feel tighter and more restricted than the other side? Also notice your hands. Does one hand feel like you can push harder, feel more grounded? Do you feel that you have good pressure throughout the hand and fingers? And does the other hand feel a little less? Does it feel different? Is it harder to ground and connect to the floor? Good. So now we're going to shift into what I call an inverted sit position. Knees are bent in front, hands are coming down at the hips or a little bit behind the hips. Fingers can be turned out or turned back. Once we get here, I want to press into the floor, getting the spine nice and tall. We're going to turn our elbow pits out and away so that you feel your shoulder blades sliding down your back. I want to feel that chest as opened up as possible through the front. Once we find that position, if you want to bring your legs into a cross-legged sit, that's fine, but I'm maintaining this downward pressure, spiraled elbow, open chest. We're going to do some neck mobility. Neck mobility is incredibly important, especially if you drive, because I want you to be able to see your blind spots in order to keep you safe. So we're going to start with that one, checking our blind spots. So I want to keep those hands actively pressed down. I don't want our shoulders getting soft off the floor to where they start to shrug up. So we're actively pressing down, getting our spine as tall as possible. It's like we're trying to lift the top of the head to touch the ceiling. On our inhale, fill up that crocodile breath. On the exhale, starting to let your head turn and look over your right shoulder. Inhale as we bring it back to the center. Exhale as we look over the left shoulder. And as I'm looking, going side to side, I want to keep my head straight and tall. I want to avoid tilting my forehead and reaching more with my forehead. And in order to do that, we're going to actually reach with our chin. So as I turn, I want to see how far can I get that end of my chin over the edge of the shoulder. The more we reach from that chin, the deeper into the cervical joints that we're able to mobilize. And as you're doing this, again, notice what's the difference? Left or right? Does one side feel easier, smoother? Does the other side feel, it's a little tighter? And don't go as far. My chin does not reach that same point. Again, this is a super important assessment point. Once we get 5 to 10 reps, we're going to come back to our starting point, and now we're going to do a tilt and a lift. So eyes are going to stay straight. We're going to tilt our ear lightly towards one shoulder. This is not a heavy tilt. I'm not trying to touch my shoulder. I'm just barely letting it tilt. And from here, my opposite ear, I'm lifting up like I have a piece of string pulling on it, or like I'm literally trying to touch the ceiling with that ear. Inhale comes to center. Exhale, lightly tilt to the other side and lift. As we're lifting with that ear, so as I lift with my right ear, we can lightly downward press through the right shoulder in order to create a little bit more traction in the neck. And again, how does this feel on the right side compared to the left side? Is it smoother, easier? Does one side feel tighter? I want to assess the hands on this as well, since we're downwardly pressing through the shoulder. Are you able to get more pressure into one hand and more lift to where it's like, oh, I feel more connection and control on one side? Does the other side, it's harder to push down. It's harder to get that lift. It's harder to feel in that area. These are important assessment points. Once we get our 5 to 10, the last one for the neck is going to be glide. This one's going to feel weird. And it can look a little funny too. Continuing to downwardly press through the shoulders. I want to keep the cheekbones on the same plane. So I don't want the head to tilt and I don't want the head to rotate. This is ideally done in front of a mirror or in front of a camera so that you can see the position of your head. From here, we're going to exhale as we glide basically towards your shoulder. Inhale as we come back to the center and exhale as we glide to the other side. Now you may find that you can glide well in one direction, and when you get to the other direction, it just doesn't want to do it. The head wants to turn or it wants to tilt. And that's normal and that's okay. But that's an important assessment point. We want to work on this until we get smoother in both directions. This is a functional movement of our neck, and if you can't do it on both sides, that's going to affect other movements within your body. So this is an important one to assess, and if it's out of balance, to work on it. All right, so now we get to move into our shin box, and we're going to start to focus more on hip mobility. I'm in my left side shin box. My left knee is forward. I'm bringing my left hand down to the floor. I want to have that hand grounded through the palm. We're going to let that elbow spiral out and away so that we feel that shoulder blade hack down and back. We're letting that spine lift up to the ceiling. Nice tall spine. I want to weight shift over that left hip so that the right hip is off the floor. I don't want to try to sit keeping both hips on the floor. I'm actually taking it off so that I have room for this hip to move. The first thing we're going to work on is just a little hip opener, focusing on this back hip. We're going to inhale into that nice crocodile breath. Exhale, feel that navel draw up and into the spine, and at the same time, we're slowly lifting that back knee up towards the ceiling, squeezing into it. Inhale as we let it back down under control. Now, as we lift, I don't want to let my shoulders open up with that hip. I'm staying fixed in my shoulders. I'm isolating that hip. I only want the hip to move. I want to see how well does that hip move without moving other parts of the body. And with each one, I'm squeezing into it a little bit more. I want to notice, where do I feel that tension? Is it more in the front hip area? Do I feel it more in the groin, in the lateral, the inside line of the hip? Or do you get some pinch in your glute? Those are going to be the common areas that we're paying attention to. Once we get 5 to 10 reps, we're going to windshield wiper across. We're going to do the same thing. Palm is grounded, elbows spiraled out, shoulders packed, tall spine, and our weight is shifted over. Inhale into that crocodile breath. Exhale, draw that navel in and scoop as we lift. And I want to notice, how high does this knee move compared to the other knee? How tight does it feel? Does it feel stiffer? Does it have less range of motion? One side is going to be different from the other. If you're not feeling the difference, it will take some practice to work to where you start to be more sensitive to notice the difference. Everybody has imbalance, so it is there. It may take a little bit of practice in order to really get a good sense and feel for that imbalance. And if you notice a significant difference one side to the other, especially through the shin box hip mobility series, it's okay to do a second time around on each one. Oftentimes, coming back to it a second time makes a huge difference. We're shifting back to our first side. Continuing to ground that palm, elbow is spiraled out, packed shoulder, tall spine, and again, weight is shifted over. We're still focusing on this back hip. Now with our inhale breath, I want to think of that breath as having weight. It's got weight like a bowling ball. As we breathe in, that ball is going to move into that back hip bowl, the bowl of that back hip, moving it towards the floor. I want that to drop the hip. I don't want to shift my weight into it. I'm still shifted forward, but that breath is going to reach that hip to the floor. Can it touch? How close does it get? As we exhale, we're going to let that hip move up, forward. I want to think of like the bony prominence of the hip. How far forward can we get it to go? And then the last part is that tailbone. I want to get those fingers of that tailbone scooping and reaching forward. The more we get that scoop at the end, we should feel some stretch. Could be mild stretch. It could be a significant stretch on the front of the hip. Inhale, fills up that back bowl, reaching it to the floor. Exhale, it comes up, moves forward, and actively scoops. How do you feel that stretch in the front? The more we get this front of the hip fully extended, straight, the more we should start to feel some tightening and contraction in the glute. If you're not able to get that hip straight, you're not going to get the glute contraction. Hip extension, by definition, means glute contraction. So if you're can't get into a fully extended hip, you're not going to get a fully contracted glute. And that's going to create some glute problems. So we want to mobilize this area, noticing if it's tight, restricted, and working on it in order to get better glute function. Once we get 5 to 10 reps, do the same thing on the other side. Again, grounded palm, spiraled elbow, packed shoulder, tall spine, weight is shifted. Nice inhale into that back hip bowl. Exhale as it lifts up, reaches forward, and actively scoops. This one is usually an easier assessment to feel the difference because it tends to pop up a little bit quicker for people. Is this side tighter, more restricted than the other side? Are you able to get as much scoop? Does that feel like a greater tension on the front of the hip? Is it harder to feel that glute tightening up and contracting in the back? Once we get to our 5 to 10 reps, we're now going to come back to the other side. We're going to do the exact same movement through that back hip with our breath, but we're now going to add another element to it. I'm going to add some rotation. So nice inhale into that back hip bowl, reaching it to the floor. Exhale as it lifts, move forward and scoops. We want to lock in as much of that back hip as you can first. And then I want to turn my shoulder. So I'm working my right hip at the moment as I scoop, which then means I'm going to turn my right shoulder towards my front knee. I want to see how far can I get that shoulder to reach to that knee. Once I get that reach, I'm then going to spread my hands wide, extend my elbow fully, spiral the palm up to the ceiling, and continue to reach forward. Inhale, I'm unspiraling, elbows pulling in as I bring that breath all the way back into that hip. So again, on that inhale, we're filling up that bowl. Exhale, hip lifts, moves forward, scoops, locking it in. Then reaching that right shoulder towards the right knee as far as you can. I want to feel that stretch draw up into that low back space. And then hand spreads, elbow extends fully, palm spirals up to the ceiling, and then continue to try to reach. Inhale, unwinds. Exhale, locks, extends, spirals, and reaches. I want to feel this nice tension created in the hip turn into more of a spiral rotational stretch into the low back and even all the way up into the shoulders. Then we'll switch sides. And we're going to do the same thing. Again, grounded palm, spiraled elbow, packed shoulder, tall spine. Inhale into that back hip bowl. Exhale, lifts, reaches forward, actively scoops, lock it in, reach the shoulder, spread the hands, extend the elbow, and reach a little further. You may notice if one hip was tighter, more than likely as you add in the element of this rotation, oh, you're going to notice that that rotation is tighter as well. And that's going to be that noticing tension in one area and how it connects into other areas of the body. This is where we get to start to map out these tension patterns. And as we map them out into larger patterns, it makes them a little bit easier to work on them. Coming back to our starting point, now we're going to get into some just simple folds. So that back hand is going to come off the floor. We're going to focus on the shin of that front knee. I want to keep shoulders square with that shin to start with, and our hands are going to be square with the shin to start with. And this is our basic assessment. We're still using that breath into that back hip bowl. So as you inhale, fill up that back hip bowl. As we exhale, lifts, moves forward and scoops so that we lock in that back hip. Then we're continuing to exhale as we let our hands slide straight through those shins. Inhale, bringing it all the way back up. Now I want to watch to make sure that we're reaching evenly. If one hand starts to slide further forward, it means that your shoulders are no longer square. And that's going to be an indication that you might have some immobility in the low back. So I want to have this as that's the reason we're using this kind of shin angle is to assess so that we can compare one side to the other. One last thing on these, I want to make sure that our spine remains tall. I don't want to drop my head or my chest straight down to the floor. I'm not doing this to get into that hip. As I exhale, my hands have to slide as I keep my spine nice and long and tall. Notice how far are you able to go? Notice where do you feel the tension? Do you feel it more in the front of this back hip? Do you feel it more in the back of the front hip? Or do you feel it more in your low back in general? And then once we get our 5 to 10 reps, we're going to switch to the other side, doing the exact same thing. And an interesting thing with the shin box position, when we bring that hand off the floor, you might notice that one side, your body doesn't like that as much. That's an assessment point as well. This is a postural position, and if you can't hold it as well on one side compared to the other, there's some imbalance there. So that can be an assessment point we want to take note of as well. So again, shoulders square with the shin, hands square with the shoulders. Nice inhale into that back hip bowl. Exhale as it lifts up, reaches forward, actively scoops. Continue to exhale as you start to reach through the shins. Inhale, bringing it all the way back into that back hip bowl. Exhale, lifts as you reach forward, actively scoop. Again, nice straight spine. Notice the differences on this side compared to the other side. Once we get 5 up to 10 reps on each side, now we're going to go back and forth with our shin box. We're going to do a nice little windshield wiper across. At this point, I'm less concerned about following my shin box angle. I'm just doing a nice simple fold. It can be through the shin, it can be through the knee. Really, we can explore a little bit. Moving all the way across to the other side, doing the same thing. And on this, we're going to do 10, really up to 20 reps, back and forth. By going back and forth, we can compare a little bit better what is more similar and more importantly, what is more dissimilar between the left and the right sides. And as we're going back and forth, once you get 3 to 5 reps, we're now going to start to change our shin box angle. I'm going to let that back knee open up a little bit, slide back just a hair as I get into my fold. I can bring it back up to windshield wiper across, and then same thing, opening that back knee as I get into the fold. By changing our shin box angle, we're going to put that back hip in a little bit different tension position, so we can kind of notice, is it a little tighter on the right leg compared to the left leg? It also allows us to get into that front glute a little differently with each one. And as we go back and forth, we're going to continue to open up that back leg a little bit more and a little bit more, until we get closer and closer to what we would consider like a yoga class pigeon pose, where we get that leg all the way back. But I'm not super concerned about that last end range. I'm more interested in everything in between, especially where it gives us some feedback. I don't want to get focused on end range poses. They look really pretty and they can feel really good. I'm more interested in the quality of the movement, and that's going to come everywhere in between those poses. And if we're not assessing the in-between spaces, we're really not getting a good quality assessment of our movement in general. And as we get to the end, we're trying to get as big in that opening as possible. If you cannot get far back, I'm not concerned about that. I want you to move within the range that you can. The idea is that over 30 days, this will improve and get better. All right, so now we are going to move on to our back. And we're gonna get into some rotation. So first one is on our back. We're gonna bring arms out to the side with the palms straight up. And this is one where I like to imagine we are laying on sand. And I want to make an imprint of the upper body in that sand. So hands are spread wide and I'm pressing down into the floor. And I want to feel that pressure through the upper back, shoulders, out to the elbows, forearms, back of the wrist, back of the hand, even pressure throughout. And I want to maintain this perfect imprint as we do our spinal mobility. We're going to be working low back here. But the important thing here is not losing this imprint. From here, we're going to bring our feet off the floor. Knees are going to be tight towards the chest. We're about 90 degrees at the knees, but I want to be less than 90 degrees at the hips. So we're bringing the knees in a little bit tighter so that they're kind of crunched in towards our chest. And again, palms are up, creating that nice imprint in the sand. From here, we're going to start to let our hips rotate side to side. Keep it small. We're inhaling as we come to the center. We're exhaling as we move out to the side. And with each one, we can get a little bit bigger with our rotation, as long as it is not lifting or smearing our imprint in the sand. Again, what we are holding through the upper body is more important. We're really focusing on the upper body, not on the hips. But we're seeing how far can we rotate the hips while we maintain that nice imprint in the sand. And as you go back and forth, you may notice, oh, I can rotate a little bit more towards the right, and I can still control that shoulder. But when I go to the other side, oh man, that shoulder wants to lift. It feels tighter, it's more restricted, it's harder to do. Again, those are kind of what we're trying to assess. What is the difference in the range of motion, left side to right side? One last little tip to pay attention to on this are your knees. When your knees are straight up, they should be perfectly square. If you put a level on top, they would show that they're even. As we rotate, they should remain in that same square position. But what'll happen is one leg will stay behind and they will get unsquare. And what that means is that that hip is not actually rotating. So I want that hip to stay even so that the knees stay even. That may be difficult to do, but that's something we want to pay attention to as we get into this movement. We'll go ahead and let the feet come back down to the floor. We're going to go, both legs are going to go straight. We're going to bring one foot flat to the floor, and then we're going to move that foot out to about 45 degrees from the midline of the body. So from here, I want to move that foot out about 45 degrees. We're going to maintain a perfectly flat foot. I want to feel the ball of the big toe, ball of the pinky toe, and heel evenly grounded. We're going to start with a glute assessment. This is one of the more important assessments that we can do. It also works as a really good glute activator. So it's not only an assessment, it tends to work to help get a little bit better function out of the glutes. With that knee directly over the heel, we're going to start with some breath, breathing into that belly. Allow the belly to kind of pull up to the floor. It may lift your spine. And then as we exhale, feel that navel press your spine to the floor, and we're lightly scooping. I'm not lifting a whole lot. I just want to feel that tailbone scoop towards the ceiling. Inhale, lifts the belly. Exhale, feel that light scoop. As you feel that light scoop, you should feel a little bit of light downward engage pressure through the foot. I want to feel that grounding pressure in the foot. That's really, really important. And we're going to continue to start to scoop higher and higher off the floor on that exhale till you start to feel some stretch through the front of the thigh. Inhale, lets it all the way back to the floor. Exhale, feel that scoop lifting up towards the ceiling. The opposite leg should be completely relaxed. There should be no downward pressure through that opposite heel. So if you feel that foot pushing down, try to let it go. Shake it out. Take that energy out. Notice if the opposite hip is trying to lift off the floor, or if you can even put your hand on that glute and feel if it's contracting. It should be soft. It should not be active. Get that focus just on one side, and it's like we're lifting that hip as if you're trying to roll yourself over onto your belly. And as you're doing this, we're trying to get higher and higher with that scoop. If you feel a stretch through the front of the thigh, we want to actively move into that stretch. The more you move into that stretch, the more you should start to feel that tension, that contraction in the glute. And this is a movement I want to do 10 to 20 reps on because I want that extra engagement in the glute. I want to build that neurology of foot into glute activation. Things to notice on this. How much stretch do you get in the front of the thigh? How much contraction do you feel in the glute? And then notice your knee. Does your knee feel wobbly, shaky? Does it want to turn in to where you're losing contact with the floor at the foot? Does it want to turn out? We want to do that so that we can compare the right side to the left side. Once we get our 20 reps, that glute should start to feel a little fatigued and might even have a little bit of burn to it. That's a good thing. We'll go ahead and switch. We're going to do the same thing on the other side. Bringing that foot flat to the floor, moving it out to about 45 degrees from the midline of the body. We're going to start with nice breath and light pelvic tilt. So inhale, let that belly lift. Exhale, navel to the spine as you lightly scoop that tailbone up to the ceiling. And again, do you notice that foot engage to the floor a little bit more? You might notice that it doesn't, that this foot feels a little less engaged than the other side. Again, that is what we're assessing for. As you're getting into it, we're going to keep letting that pelvis scoop a little higher and a little higher till we start to get that stretch in the front of the thigh. Again, check in with the opposite side to make sure that it is not active, it's not pushing down, you're not trying to lift that hip up. That other leg should be completely flaccid and relaxed. And with each one, we're scooping into it a little bit more. If you've got a good stretch and you can feel that glute contracting, continue to move into that stretch lightly to get that maximum contraction in the glute. Notice your feet. Are you able to remain at even grounding throughout the foot? Is that stretch bigger in the front of the hip? Can you feel the same level of contraction in the glute? Does that knee feel a little shakier on one side compared to the other? Those are going to be really, really big and important assessment points, especially that shaky knee. If you have a tighter hip, less contraction in the glute, and a shaky knee, then the diagnosis is that one side of your glutes is functioning a little bit more than the other, which the easy way to say that is that you're probably walking around a little bit half-assed. And we don't want that. We want to get that full activation on both sides so that we're walking with better balance. Once we get to 20 reps, and we've got that same level of activation in the glutes, we're going to bring the feet flat and we're going to come back into our breath, crocodile breath, making our big C shapes with our hands, thumbs going into that low back, index fingers wrapping around to the front, hands below the ribs and above the hip bone in that nice meaty section of the abdominal wall. And we're going to get a good 5 up to 10 nice, slow, full breaths. With each breath, see if you can expand that balloon a little bit bigger and a little bigger so that by your last breath, it's the biggest that it's going to be. Full inhale. We're also doing a full exhale. Again, let those hands slightly clench down on the exhale so that you have resistance to feel that inhale level of the breath. How does that feel in the right side compared to the left side? Are you feeling that same level of activation into the thumb and the palms on each side, or is it a little bit different? And how does it feel compared to the beginning of the class? Do you feel like you have a little bit more room, a little bit more volume of breath capacity that you can get? After you get a good number of breaths in, let's let those hands soften down to the side, palms up. Let the shoulder blades relax a little bit more. We're going to continue with that crocodile breath through the abdominal wall. But I also want to let that breath start to move up into the ribs with the same concept. Can you feel that breath moving into the chest, out through the side ribs, and into that mid and upper back area? You can imagine that inhale. We're breathing in and we're filling into tension. Feel that tension. Notice where it's at. On the exhale, see if you can let that tension go. Can you let it release, rinse off, flush away into the floor? We're breathing into tension. We are exhaling and letting that tension go. Can you feel it melt? And you can take as long as you need with these breaths, getting that nice final scan of the body. Also just breathing in that tension and feeling that tension melt. When you're ready, you can open your eyes and take your time getting up I want to make sure that you're not dizzy or lightheaded before you come up to a full seated or standing position.